So the report being published today is about the sharing of personal data between and within public sector organizations. So what this means in practice is, for example, how does personal data about an individual get, for example, transferred from a general practice to a hospital trust, or how more complex forms of data sharing can take place. These are generally known as multi-agency data sharing. So this would be, for example, in the case of homelessness, of how local authorities, the police force, or the NHS manage to adequately share data to help people and sort of flag them to the most adequate services. So data sharing has been something that the government has been talking about quite a lot and has been very invested in trying to get data right. However, on the ground, things have been a bit more difficult as the type of multi-agency sharing has been a little bit more difficult to coordinate, and there are several reasons for this. And so this paper really tries to explore what are the barriers which are preventing this type of data sharing to happen a bit more often when it actually should happen. And the paper also looks at basically the sort of cases of best practice on the ground and what you can really learn from the benefits of sharing that data at the same time as highlighting the costs of not sharing.
Data sharing can help government to achieve its aims of creating joined-up services created around the individual. It can help to improve the design and efficiency of services, as well as help government and public services to understand the needs, the complex needs facing the population. In Bristol, for example, its Homeless Health Service is using data sharing from a variety of different data sets to better understand the complex needs facing the homeless population. Without data sharing, it can result in certain people in society falling through the cracks and the gaps of services.
So, enabling effective data sharing between different public sector bodies demands improving the overall quality of data, so how it's stored and how it's recorded and kept over time, and also improving the interoperability between different IT systems which record data across government departments. It also means building trust between different government organisations, but also between government and the public, where trust has historically been quite low. And finally, it means demystifying some of the legislation around data, which can often be quite nebulous and difficult to understand. So in the report, we list a number of recommendations to try and overcome some of these barriers and improve data sharing between organisations, such as creating a quality kite mark, for which recognises well-maintained and high-quality data sets, for which all public sector bodies can eventually qualify, and also supporting initiatives such as understanding patient data, which really help engage citizens in how their personal data is used and make sure that they have a stake in how they want it to be used and by whom in the government.